Good evening. If you could take your seats, please. Good evening. Welcome to New Orleans. Welcome to the annual meeting of the American Society of Tropical Medicine and Hygiene. My name is Dan Bausch. I'm the Scientific Program Chair for the Society. We're really happy to see you here. Thanks so much for coming to New Orleans. I'm going to go just through a few of the highlights of the meeting before we move on with the program with a great speaker tonight in Dr. Moetti. The first highlight that I wanted to bring out was just that you're all here. We'll have about almost 5,000 people from across the world of more than 100 different countries, and I want to especially welcome the people who have come from other countries overseas. We know how hard it is, and it takes a lot of energy and cost and logistics to come to the United States for a meeting like this, so we really appreciate you being here and welcome your presence. This is the 100th year anniversary of the 1918 flu, and so we thought it was appropriate this year to emphasize outbreaks and flu in our program, and so you'll see throughout the program a lot of different things related to outbreaks, so a lot of Ebola sessions and a lot of flu sessions, and we'll start off tomorrow morning with a really great session entitled Tackling Outbreaks, in which some of the leaders in outbreak response will talk about how to navigate these complex entities. And so please join us for those. But if outbreaks are not your thing, there's everything else still. We have all the malaria, all the neglected tropical diseases. Name your particular thing in entomology or virology or whatever it is. I'm sure you'll find it here. The one unfortunate thing that I was going to highlight, we had a novel thing this year with the Preston brothers, two authors, Doug and Richard Preston, in a session that we entitled Tropical Bookshelf, and unfortunately, due to an illness in the family, the brothers have had to cancel their attendance. So we wish them well with that and hope to perhaps put them into the program next year. You may notice that we have these beautiful banners from the Smithsonian Institution, and so these are derived from a great exhibition at the Smithsonian, the Natural History Museum there in Washington, D.C., which I definitely recommend going to visit if you have a chance. We have just little parts of that, but you'll see them throughout the hotels, both hotels here in the Marriott and across the street at the Sheraton. And we're fortunate to have Dr. Sabrina Sholts, who is the lead curator for this exhibit, with us tonight to give a few words about the exhibit. So I'll turn the microphone over to her. Thank you, Sabrina.
Thank you, Dan. Thank you, everyone. Thank you, FASTMH. It is such an honor and a pleasure to be here and part of this event. The Outbreak Exhibit started with an idea from an infectious disease physician named Dan Lucy, who maybe some of you know and who's here tonight, when he was treating Ebola patients in West Africa in 2014. At that time, the public was not getting a lot of information about zoonotic diseases and how they can emerge and spread anywhere on our human-dominated planet. 4 years later, with the help of many organizations that are part of this conference, and some of whom are listed on this panel behind me, Outbreak is doing just that. We are educating the public about zoonotic diseases, pandemic risks, and the interconnectedness of human, animal, and environmental health. And we are doing this on a global scale. You see here, this is the Outbreak Exhibit in our museum. Well, we've made another version of it that we wanted to be used by communities everywhere in the world to address local health needs. It is called Outbreak DIY. And it is essentially a free public health toolkit. It includes electronic files for panels like those that you see displayed around me and you see around the conference in the next few days, customizable templates, videos, interactive games and maps, training materials for volunteers, a style and a resource guide with information and tips. We offer all of these materials in English, and we've translated a lot of them also into French, Spanish, Arabic, and traditional and simplified Chinese. Since we launched Outbreak DIY 5 months ago, we've had over 100 requests for these materials, and dozens of requesters have already done Outbreak themselves by customizing panels and doing additional translations of content into Finnish, Swedish, Thai, and Khmer. Outbreak DIY is new for the Smithsonian. It is an experiment that is revealing the endless ways and places that community engagement in public health education can happen. On social media, we are sharing photos of Outbreak DIY as it is used all over the world in hospitals and libraries and universities and museums and conferences. And please contact us if you or someone you know might want to use Outbreak DIY as well. It's never been more important for scientists to get involved in communicating about their work, and I think in this connected world, we've never been in a better position to do so. So congrats to all the winners tonight, and have a great conference, everyone. Thank you.
Great, thank you so much, Sabrina. It's really great for us to be able to partner with you in the Smithsonian. So we hope this is the first of many to come on that score. As you can imagine, a meeting like this does not come off easily. There's a lot of logistical preparation, and so I want to thank the many people, too many to name, but the FASTMH staff, Burness Communications, many others who make something like this happen. We have a series of program committees that take your abstracts and symposia and funnel through that and bring it to really present, we think, some of the highest quality science in the world, and I want to thank them for those efforts. We also have a number of sponsors and supporters and donors to thank, and I will name them because it's extremely important for our society. So Bill and Melinda Gates Foundation, Takeda Pharmaceuticals International, Novartis Social Business, the Celgene Corporation, Tech Lab Incorporated, the Indiana University Ryan White Center for Pediatric Infections and Global Health, BEI Resources, Sanofi Pasteur, Wellcome Trust, PLOS, and Elsevier are our sponsors. Our supporters are Burroughs Wellcome Fund, the Thermosurgery Incorporated, International Association for Medical Assistance to Travelers, and Vulcan Incorporated, and last but not least, our donors, Dr. Annie Petrie and the late William A. Petrie Sr., the Petrie family, Michael Gottlieb, Thomas C. Green Jr., and Joel Moss. Thank you very much for your support to the Society. Also, don't forget to visit the exhibit hall. Lots of services and the latest things there on display, and so that's also a part of the meeting not to be missed. I'll finish now in just a minute, but two last words. Don't forget, of course, after the program tonight, that we have the opening reception across the way in the Sheraton. That's in the Napoleon Ballroom on the 3rd floor. And we'll have a little bit of New Orleans flair to lead you there, and you'll see what I mean in an hour and a half or so. And now I'm happy to give the microphone over to FASTMH President Regina Rabinovich. Thank you very much, and welcome.
Welcome to New Orleans. Thank you, Dan. I want to thank you as well under your leadership and with Associate Chair Stephanie Yano and the hard work of all of the members of that committee, which is actually quite a large one, and it's what it takes. We have an outstanding scientific program this year. The Society would be unable to do this without the efforts of the entire committee, so thank you very much. Welcome to everyone to the American Society of Tropical Medicine and Hygiene's 2018 annual meeting. The last year has gone really, really quickly. And what a year it has been for our society, for tropical medicine and hygiene, and for global health in general. The political climate in the US and globally remains challenging, and we continue to face funding threats to the health and welfare of our world. And I can assure you that the society remains deeply engaged, not only through your work to create innovative solutions and to advance them in the field, but also in advocacy to have groups that are critical to important decisions recognize the issues that need to be considered in making decisions. Among other outbreaks, we also faced another Ebola outbreak in Africa, this time in the Democratic Republic of Congo. And there were two things I was aware of as the days for TropMed were approaching. The first was watching this one evolve and wondering how would it affect not only the communities at risk, but the society meeting, because I remembered the last time that we were here, it was a huge issue, which almost led to the cancellation of the meeting and the struggles with how to handle it and how to make decisions that encompass both public health and the health of everyone at the meeting. And the other one was watching a hurricane get closer and closer to New Orleans. And although I've lived in North Carolina and I'm familiar with how one prepares for these, the ones that we have faced this year have been rather devastating. So on the good news side, there's other things that have happened, and let me just comment on a couple of them. In June, the FDA approved the new drug Crintafil, I call it tafenoquine, which can prevent the relapse of Plasmodium vivax malaria with a single dose, and this is something we've been waiting for a while, so that was really good news. And then in September, the FDA added 4 tropical diseases to its priority review voucher program, covering Lassa fever, chikungunya, rabies, and cryptococcal meningitis. And these additions can help facilitate industry engagement in creating new products for solutions to these diseases. And we actually need more of these kinds of interventions that, along with funding and along with really good science, can actually result in ability to cure or prevent diseases. I was also aware, and we spoke about it last month, the United Nations held its first high-level meeting on TB. That was actually pretty amazing to realize that there had never been one held that had high-level participation of countries. The meeting took place at the same time that preliminary but encouraging results were released from the phase 2b clinical trial of the M72 B clinical SO1E tuberculosis vaccine candidate that resulted from a partnership, from a public-private partnership between ARIS and GlaxoSmithKline. So it was a really important step forward because we've seen a lot of trial results, but have not seen positive results, although not perfect, and very encouraging for the field of tuberculosis, which causes an important burden on global health. There are also opportunities available in the coming year despite the complex political situation here and in other countries. And one opportunity for the U.S. is commitment to the U.S. Global Fund, for the U.S. to make commitments to the Global Fund for AIDS, TB, and Malaria, which is having its replenishment in March of 2019. And that matters to us. It matters to us because it impacts on malaria, because TB is important, because the 3 diseases together require constant pressure, or we will see resurgences, and hopefully not epidemics. Now, on the other hand, this week, I heard 5,000 today, and I thought we were at 4,700, but we'll see what the final count is. I think that makes it the largest meeting that we've ever had. And you come from more than 100 countries. Pre-registration shows that 40% of registered attendees are from outside of the US. And this has been a certain trend for the society. Deeper, and we've made things possible through some adjustments with fees, et cetera, through travel awards and through engagement of everybody in the scientific program. But there are 2 people I would like to call out. That's thrilled to meet one of them earlier, and I know that they're both here. The first is His Excellency, the Ambassador of the Republic of Mali, who's come to the United States, Mohamedou Nimaiga. Welcome. I can't see you right now, but there you are. Welcome to New Orleans, Ambassador. We're very glad that you joined us. And Jim D, I don't know how you did that, but that's just great to have you here. The other is His Excellency, the Vice Minister of Health and Social Welfare for the Government of Equatorial Guinea, Mitwa Ondo Ayakaba. Welcome to you also, Your Excellency. And I'm not sure that I can see you. There you are. Thank you. You may recall the article that Phil Rosenthal and the committee wrote on the international ASTMH. We are the American Society, but it's really at this point that you can see not only engagement of our international members, but your participation that makes this what we are today. And both TropMed, global health communities, all of this is what gives us our strength and our ability to move us towards our ultimate goal, a world free from tropical infectious diseases.